Hi, good morning.
Good morning.
My name is Lucia. I'm a student nurse and I'm here to do a physical assessment on you.
Okay.
Um, so I'll wash my hands and I'll provide privacy. I'll make sure I identify my patient. Could you state your name for me, please?
Jacqueline
I'm
Hunter,
looking at the bracelet to see if it matches. And your date of birth?
September 16th, 1967.
Yes, I have a right patient. So, ma'am, what I'm going to do is I'm going to be touching you, just assessing your entire body. Do you feel like using the restroom?
No, fine.
Oh, okay. Thank you very much. Um, do you know what today date is?
Today is September 12th, 2020.
And
Saturday.
do you know where you are?
Yes.
Where's that?
Washington, D.C.
Okay. Do you know who the president of the United States is?
Yeah,
Who is
45.
that?
I don't say his name.
All right. Thank you very much, ma'am. Okay. So, have you had anything to eat in the last 30 minutes?
No.
All right. So, I'm going to take your temperature. Open your mouth for me, and I'll put my probe under her tongue, and I'll take down the reading. Normal finding should be 96.5 over 9, or 96.5 to 99.7. I'll take her brachial pulse, and I'll count the heart rate for complete 1 minute. I'm taking note of the reading, the bounding, and any irregularity. I'll look at my patient without informing her, and I'll count her respiration, the rise and fall of her chest, and I'll count it for a complete 1 minute. The normal finding should be 12 to 20 beats per breath per minute. Okay, ma'am, I'm going to take your I'm going to take your blood pressure, okay?
Okay.
All right, I'm going to use the two-step method, making sure that my client's hand is on the same level with her heart. We use this. Thank you. And I'll rest it, and then I'll make sure that her feet are flat on the floor, and I'll locate the brachial pulse, which is, I'll place my cuff 2.5 inch above the brachial pulse. And I'll make sure that it's not very tight, neither is it loose. I'll use my 2 fingers and check. If it fits comfortably, then it's okay. I'll pump the cuff while listening to her palpation, her brachial pulse. And when I stop hearing the brachial pulse, I'm going to add 20 to 30 and I'll deflate the cuff. I'll wait for 15 to 30 seconds and I'll inflate again. And at this time, I'll use my stethoscope. I'll use the diaphragm of my stethoscope and put it gently over the brachial pulse, and I'll listen to her heartbeat. I'll inflate the pulse, deflate. I'll listen to the first beat or the first pulsation and the last pulsation, and I'll record out my finding. All right, ma'am, how you doing?
I'm fine. Thank you. And yourself?
All right. I'm good, thank you. All right, ma'am, so I will be touching you in my hands and with my stethoscope, okay? So I'll inspect my client's head. I'm looking at the hair distribution, and I'll palpate for any indentation or swelling. Ma'am, do you have any problem with your hair? Have you had an accident before?
No.
Okay. Do you have any migraine, headache?
No.
All right. I'll palpate. I'll look at the ears for symmetry. Look for any drainage, any mole, abnormal mole, and I'll palpate for any mass around her ears and at the back of her ears. I'll palpate for lymph nodes. It should be palpable and movable. If there is any abnormality, I would note the size. I would inspect the neck. I would inspect the thyroid glands, I'll ask my client to, ma'am, tilt your head a little bit in front, and I'll stand at her back and assess for the thyroid. It should not be accessible. Okay. I'll take my stethoscope, ma'am. Do you have any eye problem? Can you see very well?
Yeah, well, yeah.
What is this?
5,
And this?
2.
My client can see very well. Okay, ma'am, I'm going to be pointing this touchlight in your eyes because I want to see your pupils' reaction to light, okay?
Okay.
And I'll turn off the light and ask my client to focus. Just look in front. All right. The pupils are reactive to light. Look at this. It's accommodative. The pupils are round and reactive to light. They are accommodative as well. Ma'am, can you turn your head to the right? Use your ears to touch your shoulder. Can you do that?
Just as far as I can go.
Okay. And the other side. I'm assessing for range of motion if she can
Very
tilt her
good.
head. Can you tilt your head to the back and in front? Thank you very much. With my stethoscope and the diaphragm, with the diaphragm of my stethoscope, I'm going to listen to her heart rate and her lung sound. So for the heart rate, I'm going to listen to the sound in the 5 important points: the aortic, pulmonary, the F's point, the mitral, and the tricuspid valve. I'll also listen to her pulse, her apical pulse with the bell of my stethoscope for 1 full minute. I'll take note of any murmurs or irregular heartbeats, and I'll record down my findings. I'll listen to her lung sound as I'll inspect her chest. I'm looking at the color, warmth, any abnormality, lesion or bruises, and I'll listen to her lung sound. Ma'am, could you take a deep breath in? Out. In. Out. In. Out. In. And I'll listen to her, the 2 lobes. I'm listening for any adventitious sound, any wheezing or crackles. And if there is any, I'm going to record down my findings. I'll listen to her posterior lungs. Ma'am, could you tilt forward? And without exposing every area, I'll expose just the back of my client. I'll observe, I'll inspect the color. And if there is any lesion, I'll look at or bruises or mass. And I'll listen to the posterior lungs. Take a deep breath in, out, in, out. Because I'm at the back, I'm going to palpate the back. I'm looking for any mass, any swelling, any bruises. Say 99.
99.
99.
99.
Thank you. You can lean forward. I'll inspect my client's hands. Okay, I'm looking for any wound, any swelling. I'll palpate for temperature, coloration, if it matches her ethnicity. I'll look at her nail bed, her fingers, and I'll test for capillary refill, which is less than 2. I'll do the same with the other hand. I'll look at her pants. Ma'am, push me. Can you push me? Good. I'm testing for force. She's so strong. Thank you very much. I'll expose the abdomen of my client. I'll inspect the rise and fall of her diaphragm, how she's breathing, the muscle she's using in breathing. I'm going to inspect the umbilical, if there is any drainage, if there is any pulsation in her abdomen, and I'll take my stethoscope and listen to her bowel sound, listen to her stomach sound in all the 4 quadrants, just around her umbilical. I'll start with the left, lower quadrant, right, upper, and the sound should either be hypoactive or hyperactive. If I hear no sound, then I'm going to listen to for one full 5 minutes for in all the 4 quadrants to be sure that I did not get any bowel sound. I asked my client, ma'am, have you had any bowel movement today?
Yes, well,
Okay,
yes.
so how was it? Was it regular, irregular?
It was regular.
Okay, so what about your urination? Do you pee very well?
Yes.
Are you sexually active?
No.
Okay. Just asking that. I'll listen to the
Don't seem a
femoral
little upset.
pauses. I'm so sorry. I'll listen to the femoral pauses bilaterally. I'll listen to the brachial pauses as well bilaterally. I'm comparing the readings. Yeah, which are so present, the pounding. I'll stretch my client's feet. I'll inspect the feet for symmetry. Put both feet together. I'll inspect the feet for symmetry, coloration, any bruise, any lesion. I'll palpate for warmth and dryness. Her feet are warm and dry. I'll look for pallor or ecchymosis or cyanosis. I'll inspect my client's toes. I'll inspect my client's toes and the feet. I'll check capillary refill and the pedal pulses. I'll listen to the pedal pulses bilaterally. I'll listen to the tibia, posterior tibia pulse bilaterally. I'll check for Babinski reflex. Her feet did not flare out. Okay. Sorry. Thank you very much. I will also check for the popliteal pulses, which are just beneath her knee. I'll ask her to stretch her legs, and I'll listen to the pulses bilaterally. Okay. Because my client has a mask on, I'll wash my hand. I'll wear my clean gloves. I'll ask my client to take off her mask if she can. I'll inspect her nose for symmetry and alignment. I'll tint her head behind, and inspect both sides of the nose for any drainage or abnormality. I'll ask my client to open her mouth, and I'll inspect the tongue. I'll inspect the throat, and I say, there's gap reflex is positive. I'll look at the tongue and her dentation. If any teeth has been removed, I'm going to record down my finding. If there are any wounds in her tongue, I'll record it down. I'll look at her lips for it should be moist. I'll look at her ora mucosa. Open your mouth. It should be moist and pink. I'll look at her conjunctiva, which will be white and pink and moist on both sides. Okay, so I'll look at her eyebrows. I'll ask my client to rise up, and I'll look at her coccyx area because no, that's fine. I'll look at her coccyx area because that's the probability for her to have a bed sore is high. Ma'am, could you just lean back? Yes, I'll take off my dirty gloves, wash my hands, and I'm going to palpate my stomach, my client's stomach. I will palpate for any mass. Do you feel anything?
No.
Okay, I'll palpate the liver, and that's fine. So I'll wash my hands and make sure I document my finding, and if there are any abnormalities, I'm going to notify my provider. I'll lower the bed. I'll put the bed to a very low position for my patient's safety. I'll provide my patient with a call light. Ma'am, this is a call light. If you need anything, you could just ring it and somebody will come from the nursing station, okay?
Okay.
All right, I'll wash my hands, take off the privacy, and I'm done.